Bismillahirrahmanirrahim. Good evening, everyone. My name is Dilshad Pirani, and I welcome you all to our Health Insights webinar titled COVID-19 Vaccines, Myths, Mysteries, and Facts. Today's social media and all news channels are filled with the latest information and development on COVID-19 and its management. We have been hearing about many vaccines and different opinion, anxieties around their effects and side effects. With the deteriorating situation and recent lockdown in many countries, I'm sure that all of us have questions in this regard. We are honored to have with us Dr. Mohamud Verjee, who will answer your questions. Dr. Verjee is the Assistant Dean for Medical Student Affairs, the co-director of the Primary Care Clerkship, and an Associate Professor of Family Medicine Clinical Medicine at Weill Cornell Medical College, Qatar. After years of experience in teaching and practicing family medicine in the United Kingdom, Dr. Verjee moved to Canada in 1994. In 2003, he was appointed as a clerkship director at University of Calgary, and he's been the Gulf, since then he's been in Gulf region since 2007. A widely published researcher, educator, motivational speaker, and a practicing family physician, Dr. Verjee has a long list of achievements to his name. As an expert consultant on COVID-19, he has conducted various informative sessions on the outbreak. He is also the point physician for COVID-19 at his university. Dr. Verjee will speak about the COVID-19 vaccines, myths, mysteries, and facts. The session will begin with a brief presentation followed by a question and answers session. Thus, I encourage all the audience to please type in your questions in the QA box or chat box below. Without further ado, I would like to welcome Dr. Mohamud Verjee to share his thoughts. Over to you, Dr. Verjee.
A very good evening to you all from Canada. It's my pleasure to speak to you today. We'll try and make up for a bit of lost time. And one of the things that has been on our mind completely since we entered 2020 is the COVID situation and the vaccines which were promulgated and thought to be a possibility. Some said this year, some said next year. As a physician, I've kept a close eye on it, and I can show you some of the vaccines that are available at this time. They're approved. Now, things are running so fast that this list that I prepared just recently, last week, is already out of date. So to this, you can add Moderna, and the other two are BioNTech, Pfizer, which is combined, and the third one coming up is AstraZeneca. The important part about this is that there are many vaccines in development, and that all of these vaccines approved have now spread across the world and are in process for a vaccination program. It's not a question of limiting the vaccines, but it's a question of understanding them, how they work. And one of the things that is important is to understand at this stage that we cannot relax our vigilance and our protocols on hand washing, facial masks, social distancing, and also taking extreme care with any kind of visits outside the home, making sure that we prevent ourselves from being infected in the first place. This must be part of your daily life. Not only has it been for the past year, since March, but it will need to be the case for the next year too. I'm sorry to disappoint you on that, but I also want to say to you, if you do that, the chances of you developing or catching COVID are as low as they could be. If you don't adhere to that guidance, that valuable guidance there, you lay yourself open to infection. The vaccines are going to take time. And although there are certain countries, including the UAE, have found a vaccine which they already have in place, which is in fact of Chinese origin, the approved ones, as I mentioned earlier, are being distributed as we talk. Next slide, please. This is perhaps a little bit more revealing in the sense it gives some names which may be familiar to those who are looking at the screen. But even then, Moderna, which has now changed from being under review to approved, you can see how quickly the changes have taken place. These are vaccines which certainly have a great future. And although some of them are not approved, my suggestion is only to have the vaccine which is available in your country, which has been approved by the public health authorities. I'm going to come on to safety in a moment. Next slide, please. So I'm going to discuss some myths, and one of the things that was mooted earlier on was that the vaccine that was going to come on board was very hurried and took short cuts and short steps and was somewhat unreliable and so on. I'm very happy to say that as far as I have investigated, the vaccine has been thoroughly researched, and no company, each company developing a vaccine has pledged not to actually provide the vaccine until it has been fully checked and approved officially. So there have been no shortcuts. What has been very important is the revolutionary way in which we can now produce a vaccine, which formerly took 25 years and then maybe 15 and then 11 and then sort of down to 9 and 5. And here we have within a year, which is an absolutely superb feat. So there is no question of the ones that are on the market right now or being provided not being safe. Nothing has been ignored. Nothing has been shortened. Nothing has been cut out. And the one vaccine that you are offered in your area will be the one which will be best for you. Next slide. Another myth is that during the development period, that delays and pauses indicated there was something very wrong going on with the vaccine production. Of course, whenever you have any kind of event, when you shop for a product, for instance, there, 99% of the time it's fine, but sometimes you buy something and it's got a fault and you take it back and get it replaced. In this case, we're not replacing the vaccine, of course, but there have been people, and there's so many of us that each one of us are different, and we may react in a different way. But the success and efficacy rate of the vaccines currently out on distribution are between 90 and 95% effective. So that's really very, very good, considering that the flu vaccine, which is given every year, is probably very variable and may not even have that level of efficacy. So this is a single viral vaccine which has proven to be very good. Okay, so not to worry about that. Next slide. There's thought that by having the vaccine, that COVID-19 is introduced into your body. I can dismiss this with a stroke. There is no part of the COVID-19 virus, which is injected into your body. Not at all. Not a single bit. What it does is the vaccine has been developed to stimulate the response for you all to fight the infection, which is hopefully you haven't got yet. But if you meet it in the future, the body will recognize it and immediately be prepared to fight the infection as it begins to invade your body. That's the premise, basically. If you have a common cold, for instance, you know you don't feel well, you have a bit of a fever, a bit of a runny nose, sore throat, that may go on for a few days and then you recover. That is due to your immune system fighting the cold virus that you have been infected with. The same principle with all the vaccines, ones that you are probably more familiar with, like tetanus, for instance, or polio. These vaccines do not actually cause you any harm. They just stimulate the body, and the stimulus in each person varies. So some people have a very strong reaction and some people have a less strong reaction. So not to worry about that. Next slide, please. You can absolutely get the vaccine done individually, even if your family has not been vaccinated and you are at no risk of giving them anything. In fact, you are protected, and you are in a way protecting them, because hopefully you won't get the COVID infection and pass it on to any members of your family. So there is no worry about that. You will not make your family sick. Next slide. There are various vaccines, and one of the ones which is most popular has a two-dose regime. The first day you get it, and exactly 21 days later. If you only have the first shot of the vaccine and do not get the second one, just simply completely forget about it or disregard it, you will not be protected. In fact, the first shot of vaccine that you have will be effectively pretty useless. You have to have those two shots. And you must be very strict with yourself. When you have your first dose of vaccine, book the 21st day and make sure you have no other commitments so that you can actually attend on that 21st day. Next slide, please. If you get vaccinated for COVID-19, there is no danger of you having an extra vulnerability to other diseases. There are thousands and thousands of viruses, most of them harmless. But by having COVID-19, you are protected in addition to the protection you already have from previous vaccinations or from your own body defense. So it does take a little time for your vaccine to stimulate the body. It's probably going to take at least a couple of weeks or so, but you actually are not likely to have, not likely at all to suffer from any associated diseases because of the COVID vaccine being given to you. Next slide, please. With the new vaccines out, I have to stress that although the word pandemic may not be used so much, in fact, it will end in due course, the actual phase and the infective part of this era, if you like, this time that we live in, is not over. It will take approximately, probably up to 3 years for us to have a complete slowdown and cessation of passed on infections after the vaccine program has been effectively spread throughout the world. But as I said right at the beginning, we cannot afford to relax on any part of the protocol at this time. When relaxation happens, things like meetings and gatherings, visiting people's houses, weddings, funerals, and that sort of thing there, we will be guided probably on a week-to-week, if not day-to-day basis in some places, and hopefully later on a month-to-month basis to say what we can and can't do. And we should listen to our governments and adhere to that policy strictly so that we actually hopefully come through this. One of the original parts of quarantine, the word quarantine, was termed by Ibn Sina way back, where when he studied people who were infected, he actually made sure at that time that they were isolated for 40 days. And after 40 days, there was no further spread of infection. It's the same principle which goes back centuries. We have to listen to the governments, we have to adhere to the policies, and we have to understand what's happening. The vaccine is helpful to us. The only problem is getting the vaccine And that will happen over the next few months and into the years ahead. Next slide, please. There's thoughts that by having the vaccine introduced into your body that it changes your DNA, it changes your person, changes some feature of you. Not true at all. It does not change a dot. The only thing it does do is stimulate your defense mechanisms within your body, which we all have. Of course, there are some people who may have more difficulty, those with diabetes, with hypertension, with renal disease, or possibly cancer. Or those who've been receiving certain medications. Those are people perhaps we need to look at more carefully. But the vaccine itself does not change any part of your makeup, nor will it affect your children if you choose to have families in the future. Next slide, please. Who should receive the COVID-19 vaccine? As of now, there is a policy not to vaccinate anyone under 16 years of age, because we know that children seem to have better resilience and don't catch it so easily, and they actually do very well. But it has not been tested in children under 16, so that's another reason. There are very few adults who may not be able to receive the vaccine. Some of this is at a discussion basis. Some of this is an adverse effect because of what they already have as far as medical state's concerned. But they're very, very few. Most people can actually have the vaccination. When I say most people, I mean well over 95%, if not more. And the important thing is to follow the guidance. The guidance is given to us by the Centers for Disease Control in Atlanta, Georgia, and the Food and Drug Administration in the States. But minor illnesses, if you have a slight sniffle or a little bit of a dry throat and you're a bit worried, are not a contraindication to having the COVID-19 vaccination. So don't postpone it just because you don't feel that great that day. If you're very ill, of course, it's a different matter. People who are currently sick and experiencing COVID-19 symptoms or may be infected should not have the vaccination until they recover. And that's usually a period of about 2 to 4 weeks after their infection with COVID in their community. So you are not protected by just getting the COVID infection. You need to have the vaccination as well, but when you are better. We've talked about the effectiveness of the approved vaccines. All of those things really are true, and I think I've already mentioned those in my talk. The last thing is the guidance, which I think was shown earlier. And I think go to the next slide. That's the guidelines. The next slide. The conclusion, very important. So we're in a much better position than we were earlier in the year, working online at home. Talked about the period of planning for the next 3 to 5 years with free vaccines, extreme care when traveling anywhere, on anywhere. Food is not a source of infection, especially if it's cooked and it's hot. Exercise and lifestyle is important, and we always understand mental stress. It's important to connect with others and to change your lifestyle to reduce the stress as best you can. And to go right to the end, that would be useful, I think. That's be the last slide. So thank you very much for giving me this opportunity to talk. I hope I've alleviated some worries and stresses, and I'm always available for help wherever I can help. And thank you, Dilshad, for looking after it, and thank you to the whole IT team for helping me with this slightly complicated connection.